Welcome to the Spark Standards in Action Showcase, where active Spark community implementers share their perspectives, experiences, and example implementations of some of the FIRE implementation guides designed by the Spark community. Here we will have community representatives showing the art of what's possible using the community design specifications to enable safer, more connected, and more efficient healthcare. I'm your host, Michael Hosking, Deputy Lead for Community and Engagement for Sparked. For this showcase, we'll jump straight into the discussion. For a background on Sparked, what it is, our goals, and related resources, please visit sparked.csiro.au. Welcome to the Sparked Standards in Action Showcase, where active Spark community implementers share their perspectives, experiences, and example implementations of some of the FIRE implementation guides designed by the Spark community. Here we'll have community representatives show the art of what's possible using these standards and to enable safer, more connected, and more efficient healthcare. I'm Michael Hosking, the Deputy Lead for Community Engagement for Sparked. And for the purposes of this showcase, we're going to dive right into the discussion and would encourage listeners to review our Sparked 101 recordings, which will help provide additional context of what Sparked is, what we're looking to achieve, and other resources. So please see our website for more details at sparked.csiro.au. So today we're joined by Angela Ryan from Oracle Health and Jessica White from Best Practice. Angela is a registered nurse, health informatician, and executive with decades of experience leading digital health reform across state, federal, and industry roles, including her current position as lead healthcare executive at Oracle Health. She is a digital health advisor to the Digital Health Agency and a founding fellow of the AIDH and a Churchill Fellow recognised for her work in digital health and patient safety. Jessica White joined Best Practice in 2015 and leads the team responsible for delivering government and industry initiatives across the Best Practice portfolio, including managing a large network of integrated partners. With over 15 years in primary healthcare, she's a strong customer advocate focused on ensuring e-health initiatives are delivered with real-world value. Thank you both for joining us and sharing your experiences, and also a demo we're excited to see.
Thanks for having us, Michael.
Yeah, it's great to be with you.
And so from each of your perspectives, what are the current challenges of health information sharing in Australia? I'll start with you, Ange.
Thanks, Michael. Look, I think they're, as we know, very well described in terms of the way data is or does not move around the system. So we know that there are, particularly across different settings of care. So if you're in a hospital and you're using an EMR, then you'll have ready access, but what happens to the information once you move outside that environment? So particularly from a primary care setting or in fact any other setting, so that they tend to be sitting, I guess, in a silo. I think I'd sort of talk about, or the perspective I bring also as a clinician is that clinicians are always looking at ways to try and make things easier. And that's in a sense why scribes have really taken off, because in effect, they solve a particular problem. I think what we have been looking at over time and over years is having that ability to access data when and where it is needed. And I think, recently a member of my family was getting treatment for cancer up in Far North Queensland. Aside from the fact of having to move out of that setting, so move from a rural location into a bigger city, he also had the challenge of trying to, manage lots of different sources of data across GP, acute pathology, diagnostic imaging, and then oncology on top of that. So there was really no ability for him to have that data shared. And I think that responsibility tends to fall back to the patient and or the family. So really this has been a decades-long problem that we are pretty excited to try and solve.
Yeah, that sounds really hard. And Jess, what about from Best Practices perspective around the current challenges?
Everything that Ange said, I agree with immensely. It's about having that data at point of care, and we just aren't yet there yet. But I'll actually take it from like a different perspective as well. So I think having the right data available to the clinicians and assisting the patients with actually making sure that they understand what data is available is important. But I think another real life use case is making our clinicians like Ange, their lives a lot easier. And I'll touch on a bit of an example we have on our end that we talk to GPs about all the time. So not only do they not have the information available to them at point of care, but a simple thing like a referral to a hospital or a health service or a specialist is extremely complex. In fact, I was talking to a GP recently who sat between three different health districts. One hospital required a faxed referral with certain data elements. One required a name referral that was to go by email. And the third one actually still wanted them posted to the hospital. So into like obviously embedding standards and having everyone speaking the same language is going to improve things like this. And it's crazy that in 2025, we still aren't able to move healthcare data for simple reasons such as a referral process. And all of these things add to hospital wait lists, inefficient referral processing, patients not getting into their relevant specialist. And, you know, I had a GP I was speaking to on the weekend who said, Jess, you know, we're talking about Axifax 20 years ago. Look at my email. I've received 30 faxes today. So if we can solve this problem about data getting to the right place, we're all speaking the same language, we can solve this. It means clinicians will have more time to spend with their patient doing the things they love and less time focusing on admin. And patients will actually be able to get into the services that they need, hopefully, at the right time as well. So agree with what Ange said, but man, we have so much to fix, and I know Spark's going to get us there.
Yeah,
No,
well,
and it's almost, sorry to interrupt, Michael. I was just going to say, it's almost as if we went, what is the hardest and most difficult system we could design
Yeah,
for clinicians, for consumers across the system? Now let's go and do it. And
yeah,
that's kind of where we are.
yeah.
yeah, absolutely. And to that end, I guess from both of your perspectives, what problem does Spark solve? I'll
Do you
start with
want to
you,
jump
Ange.
in there? Oh, start with me. Okay. Look, I think, as I said before, you know, we've all collectively been trying for years to solve this particular problem. And I think that everyone's genuinely tried and made the best effort. I think the difference here is that we finally have an alignment of not just the willing, but the able. So we have the coalition of the willing that lines up with the leadership from government and the policy reform with associated funding. So we've kind of never had all of those things coalescing together and being able to be realised. Because I think there's always been a coalition of the willing. There have been lots and lots of community over years really trying to solve this problem, but just haven't had all of those things lining up together. So I think it has taken real leadership from the government too to recognise, well, not so much recognise the problem, but also find ways in which to address it. I think the challenge will be ultimately over time and what happens next once this period is done. But yeah, this is really you know, what is the most significant difference in my opinion.
Absolutely. Thanks, Ange. And what about you, Jess? What's the value in the approach that Spark is taking?
I agree with Ange, of course. We've all been participating in so many industry projects for the last 15, 20 years. We've been in discharge summary projects, referral projects, interoperability projects as it relates to secure messaging. We've all been at the table, and we've all been trying really hard. Having Spark come along and actually assist all of us amazing vendors to collaborate on a set of standards and an agreed path moving forward is just invaluable, because we're a bunch of separate businesses trying to do everything that we do for our customers, and having someone come and give us a big hug and bring us all together and take us on the journey is just absolutely amazing. And we couldn't have done it without them. We really needed someone to bring us all together. There's no lack of dedication from the vendors. We're all super excited to be involved. We've all been trying to do interoperability in our own ways for a number of years. We've all got APIs. I know that BP and Oracle have several partners that connect through to their systems and move data through ecosystems. But it's been challenging, it's been bespoke, it's been hard, there's lots of custom work. This allows us to actually bring people all on the same journey and on the same journey as an ecosystem. So just so excited to be part of Sparked, and yeah, they just bring so much value to all of us as a vendor.
That's great. I like that you described this as a big hug.
Yeah, it really
Um,
is, because we've wanted to do this for years, but we can't do it in isolation, and yeah. As much as we all talk and support each other, we did need a separate body to kind of bring us all together.
Absolutely, that's great.
And I guess just adding to that, it will then be the next iteration that, you know, will be sort of, I guess, the final piece in this kind of runway, if you like, because we've got a really clear mandate. You know, the government's been very clear about what it needs, and we have a fairly good idea that at the end of it, there's going to be sort of, I guess, a set of rules, I suppose, that might articulate how vendors and community will work together to implement. And that will, I think that'll really be, that's the final piece, because we can, I guess, well, this ambition can be realised provided that we're all kind of travelling on the same track, and getting to that endpoint, which will be really excited. So I hopefully we will see a sort of a full commitment or continuing commitment from government, and that has certainly been the case to date. Obviously, the results of the election show us, I suppose, that reform can continue because of, you know, commitments that have been made. So I think that's something that obviously we're pretty excited to see through.
Yeah, and I don't think any of us are scared of that either. Like we know for this to be successful, there has to be reform, there has to be legislation tied to it, it has to be mandated. Otherwise, we're not going to be able to talk to each other. So I don't think anyone here is scared, and we're really, you know, hopeful that we get to a point where we're not. Sparked was a distant, beautiful memory of ours, and fire and interrupts just part of everything we naturally do.
Yeah, absolutely. And Jess, why is best practice involved in Sparked?
I think for all the things that Ange and I highlighted before, for us as a business to hear all the fragmentation that occurs in the healthcare system, and fragmentation that we try to resolve, but we can't because it's actually an ecosystem issue. That's why we're playing. We're a part of the puzzle. We're not the whole puzzle, and it's important that we participate. You know, we need to be there advocating for our customers as well. We're there to be the voice of our GPs and our customer base, and, you know, to really ensure that we can contribute. We can obviously talk about, you know, our use cases, where we fit into the ecosystem, how we can help, and what makes sense. There's no point any of us operating in isolation. Otherwise, we're not going to get to an endpoint where we are seeing data move between primary healthcare, secondary, tertiary. You know, everyone needs to be involved.
Absolutely. And Ange, is there anything you'd add from an Oracle perspective?
I think, well, I agree with Jess. We, you know, our ambition, I mean, we may be a big, you know, global software company, but we are, you know, really invested in the betterment of the health system. So ultimately, each of us comes at it from a slightly different perspective. I'm part of a clinical team, but we're all pretty united in wanting to have, you know, a better experience for all of our customers, because in the end, you know, each of us is in effect a customer at some point. We're all consumers of the health system, and we're all deeply invested in having a better experience. So we can see where there are significant efficiencies to be gained, and we can see that this is, you know, that the path to take us there. So I think we're pretty excited about, I guess, realising that ambition, but also, you know, what's been really enjoyable for us has been working alongside best practice, because obviously we've been working together in a capacity that prior to Sparked, or prior to being part of Sparked, in our work with Western Health and the Health Information Exchange that we're implementing there. But what this is sort of been able to really bring that to life. So that power of collaboration, I guess that sort of feeling of unity and being part of something that's bigger than ourselves, I think is, sounds noble, but I think honestly it's exciting.
Yeah. And I think too, like selfishly, and I think Ange, you'd probably agree with this, we all are involved in so much work, whether it's work for customers, work for partners, or work for government. The fact is now we're reading pages and pages of documents using different APIs, different terminology, different technology. We're talking to systems differently. So I think from a software vendor perspective too, having standards across the industry is going to make the delivery of software change so much more efficient too. And I know Angie's shaking her head because it is a problem for us right now. We do have lots of disparity in how we work with external systems. So really excited for some alignment there, and all of that is goodness for our customers.
Yeah, absolutely. And I think it's been very humbling to see all of the organizations coming together in terms of meeting in one room, whether you're a multinational or a local provider or even a startup. It's great to see so much participation from the general community. Now,
and I will just quickly add, sorry,
yeah, go.
I just said something that just made me think. So, back in the day when vendors were, sort of, I guess there were more proprietary standards, it kind of made sense to an extent because your ecosystem was really different. Like you might just be, in a really small place, you might just be in a single hospital. There weren't sort of tons and tons of other systems to have to talk to. But like Jess has said, obviously that, really decreasing that effort and burden around having to now exchange information like we do has really, more than ever demonstrated the need for this.
Absolutely. And on that note, I guess I'm interested to know which Spark standards you're actually implementing and are going to showcase.
You want to take that, Jess?
Yeah. So I guess I'll talk about what we've implemented at BP. So we're using AU Core and AU Patient Summary for a number of products internally here at BP. So our new product, our BP Mobile product, which is a mobile version of our GP product, is all built on AU Core. Our Halo API is using at the moment AU IPS, but transitioning to AU Patient Summary. And our web product is also built on AU Core. So we're really starting to flesh out all of our FHIR capabilities internally, which I'm sure Oracle are as well. And our API obviously is a public-facing API, so we're really excited to start taking our 200 partners on that FHIR journey as well. So it's been really interesting for us to come into the Spark program, learn all about FHIR, bring that back internally, and now we're starting to educate external providers about FHIR. So it just shows you the power of community is just amazing. So we've obviously using the AU Patient Summary for the work we're doing with Oracle, which is very, very, very exciting. So that is obviously us at BP being able to shift data into the wonderful Oracle HIE, which I won't steal Angie's thunder because it's just a beautiful, beautiful product. And having that data set up at the hospital level, but viewable by the clinician. And I know you're going to see a bit of a demo about that later, but just the power of taking data from the primary healthcare setting up to the hospital setting, having that viewable by both parties. And, the end goal here is that we can actually input that data back into BP. So we've got real life scenario of reusable data and just really life-changing stuff for our clinicians.
Yeah, I guess the only thing I would add there is that I think it's, observing just how, it's actually been technically really easy to do. So it's, essentially we've been moving the IPS around, so the AU IPS around, and then being able to update that in real time and sort of just being able to demonstrate that to people in real life, in real time. Again, it's relatively straightforward, technically quite easy to do, but we just have it's really just taken us so many years to get to that point. So really interconnecting primary care and acute care, such foundational and fundamental things to be able to do, has really been quite remarkable. So we have the HIE sitting at Western Health, and we'll be bringing in primary care clinicians via best practice quite soon, and just the power of having a window into what a patient experience has been like, or patient information inside a hospital setting, being quite amazing.
It was crazy to see like a doctor update an allergy in BP and have that appear in the Oracle HIE, and it sounded like the most simple thing, but we've never been able to do that before. Like, it was just so great to see that live data feed happening in real time, like we've all been talking about, and accessible at point of care, which we've all been talking about. So to solve those couple of like big ticket items with Oracle, it was like a really just like crazy moment, and it just shows the power of FHIR, and it's like the tip of the iceberg, right? There's so much more to go. It's such a simple use case, and I just think in 2 or 3 years, like, we're just going to be in such an amazing position from an interoperability perspective.
Absolutely. It's the power of standards and what they can enable is what's really exciting. So I guess without further ado, it'd be really great to see I guess what you've got in store for us to show what you've been able to achieve.
Best Practice Software and Oracle Health are excited to demonstrate a live version of the Australian Patient Summary. The Patient Summary demonstration uses Oracle's Health Information Exchange platform to share patient data in near real time between Best Practice's management system BP Premier and a Metropolitan Hospital's electronic medical record. Developed as part of the SPARKS program with the CSIRO, the Australian Patient Summary uses the AU Core dataset and is aligned with the International Patient Summary Standard, or IPS. Oracle's Health Information Exchange is a revolutionary step toward data sharing in the future of healthcare and demonstrates Oracle Health and Best Practice Software's commitment to investment in the SPARK program. Australia has many digital health services spread across local, state, and national regions. Our systems are divided by funding, governance, specialty, digital maturity, standards compliance, and more. This fragmentation can act as a barrier to continuity of care. Up-to-date patient information is not available in a convenient and timely manner between providers as patients move from one care context to another. Oracle's HIE is a centralized repository where providers can access comprehensive and up-to-date patient information regardless of the healthcare system where the data was generated, connecting multiple systems. Information that can be displayed from the HIE includes laboratory results, diagnostic reports, medication histories, documents, and other patient information. Data displayed in the patient summary shows the most recent source and can be drilled down on to view underlying details, such as the last update or the investigation reports. The Oracle HIE employs standardized data and security formats and messaging protocols, including HL7 FHIR resources to ensure the confidentiality, integrity, and availability of patient data. The Oracle HIE allows technology vendors like Best Practice Software to support GPs with access to clinical information from hospitals, specialists, and other providers. For example, say a patient books a regular post-discharge follow-up with their GP. Without needing to wait for a discharge summary, the GP can open the AU patient summary from their PMS and filter to the most recent information, see the latest lab results, check for any new documents, and check for any new medications. Oracle's HIE employs the AU Patient Summary. Itself is based on the International Patient Summary, a globally recognized standard with a commitment to adoption by G7 nations. Using global FHIR standards for the IPS makes life easier for vendors to join the SPARK community and work toward true real-time interoperability. In the future, hospital networks, specialist practices, allied health, aged care, and many other healthcare organizations could benefit from Oracle's Health Information Exchange data sharing platform. The patient summary presented through Oracle's HIE can be localized based on regional requirements and clinical context. For example, the Indigenous Health Check history, found under Documents, is an adaptation of the IPS for Australia. The web portal version of the AU Patient Summary will be available for providers who are outside of the practice or hospital. Back at the desk, Single sign-on can be used to seamlessly access the patient summary from your PMS or EMR system. Other enhancements coming in the near future include the write-back of key clinical information from the Oracle HIE to the PMS, supporting meaningful reuse of data. Change notifications, so clinicians can have real-time alerts of clinical episodes, and exports of some components to CDA or PDF where required. Oracle's Health Information Exchange solves the problem of fragmented patient data across multiple systems. By enabling access to a patient's clinical history at any point of care, Oracle's HIE enhances care coordination, supports informed decision-making, reduces duplicate testing, minimizes medical errors, and enhances patient safety and satisfaction.
Thanks for sharing that demo. That was really exciting to see what the opportunities are for future of health information sharing. And you've just scratched the surface, as you mentioned, Jess. What the opportunities lay in the future is really exciting. So moving on, I guess, why should others get involved in Sparked? Ange, why should other people get involved in Sparked?
Momentum. I think, well, first of all, it's, that the ambition is there and it's real. So it's not just, all of us playing in a sandpit together, having a good fun time. I mean, that's happening also, but there are clear outcomes, and it really is, the movement and the momentum. So I think, it is a coalition of the willing. You don't want to be left behind, because ultimately you can really be part of the design. You can have your input, and you can be counted. And I think if you're not there having that conversation, then it's really, sorry, I'm just losing the plot there. Do you mind if we do that bit again?
Yeah. Do you want me to repeat the question?
Yeah, do you mind? Sorry about that.
Sure. No,
There's so much to say. I get it, Ange.
Yeah, it is. It's hard because there's a lot to it. So, Ange, why should others get involved in Sparked?
So I guess I would say two things. One is outcome, and the other is momentum. So there's a clear set of outcomes, and the ambition is actually being realized. So as we've already talked about, it's being led by by governments, by industry, by community. There's reform and funding around it. It does have a clear mandate, and it will be realised. So it's being part of that vision and the realisation of that vision, and also just being part of that momentum. I think there's a real kind of sense of unity and community in being a part of something so big. And I would love to see this kind of policy done differently, as Jeremy likes to call it, applied to other issues, other wicked problems that we could try and solve. Because I think this is a really great test case for going, when you get these things all lined up, look at what you can achieve and look at what you can be a part of. So I think if you're not already a part of it, you have to go. You have to get on board. It's time.
Absolutely. Yeah, I couldn't agree more. And Jess, what about your perspective?
I mean, I think Ange absolutely nailed it as always, but from my perspective, I see a couple of things. I think that not only are we co-designing and co-developing as a community, but you're being supported, you're being educated, and soon there'll be fire standards coming down from government and other legislative peaks. And if you're not aware of fire or not sure what it is, I do think you're going to be left behind. So I think it's really critical as a software vendor in Australia participating. It's the future. And take advantage of this amazing community, learn, grow, understand. Because I can tell you, I knew nothing about HL7 and fire before I started participating in the Sparked initiative. And now I know more than I would like to admit. So I think that's a big one. I think if you want to stay, you've got to be involved. If you want to contribute, if you need to advocate for your product, your services, your customers, you need to be there. And that's really important. We need the voice of everyone in industry. And I do think too, in 10 years' time, Spark's going to be famous. We're going to be talking about the Spark days and everything we did together and how community got together and what a wonderful initiative it was. So I think you've got to be there, have a seat at the table. You've got to contribute, and it's the future, and you'll be left behind.
Absolutely. And we're an open community, so we want anyone and everyone to participate when they can.
Yeah, and we have
And
the best conversations there, and I'm sure Ange is the same. Like everyone has a different background and different expertise and a different customer base, and play an amazing part in the ecosystem, and we need those people involved.
absolutely. And what's one key insight that you'd share with others adopting national fire standards, Ange?
I would say it's about the promise of better data sharing. So if we ultimately end up with a national fire standard, which I believe we will, then we can realise our decades-long ambition of being able to better share patient data, better share information, and ultimately lead to better health outcomes. I mean, it's, in the end, I think this is probably by far and away the biggest nut we need to crack. And I think, we're close. So yeah, that's really the key for me.
And Jess, what about your perspective?
Yeah, I think any business, any healthcare business in Australia can apply a fire use case to what they're doing now or what they're planning to do in the future. So I think that it's really important that everyone is involved. As Ange said, there's a big nut to crack, but we're going to do it. And businesses are going to be able to share data with other vendors to assist their patients and their providers. And anyone not sure about participating or not sure how it applies to them, I challenge them to present their use case to us, because I'm sure we can find a reason for Spark to exist in their ecosystem. So for anyone on the fence, not sure or not sure how it's going to apply to them, I think reach out, have a chat, because this is life-changing stuff. This is the future of e-health in Australia and the future for our patients, and it solves, I would say, a huge chunk of the problems that we currently have and that we currently face.
Absolutely. Well said. And I think from a technical perspective, I'm keen to, I guess, maybe add another thing where I'd encourage a lot of people, and both from Best Practice and Oracle, you've got significant contributions to the connectathons that we host. We work in partnership with HL7 Australia, and that's a really good place to, I guess, promote and test your products in a safe space using fire standards and fire servers to see how your products compare against the standard and whether the standard needs to change or whether the product needs to change. And I think it's a really healthy and open approach to testing products. And I'd really encourage anyone who's interested to test that out, to get involved in that way as well.
Yeah, and I think you're right. You'll be left behind if you're not participating. And I know Oracle's got significant fire maturity internally, and we're definitely getting there as well. And a lot of that is due to our engagement at Sparked. We've definitely progressed through that engagement, through our technical guys being part of the initiative, talking to others, testing out concepts. Absolutely, Michael, couldn't agree more.
Okay, and thank you very much for your time. I really appreciate everything that you do in terms of your participation in the community, both from Best Practice and Oracle, and also obviously Jess and Ange for your time just now. I really appreciate your insights and input. But finally, for those that are interested in participating in Sparked, we've included a QR code that will take you directly through to registering. And also please feel free to jump onto our website and explore and have a poke around at what we're up to. And we have a Sparked podcast, and season 1's out for those that are interested. And we also are working on season 2, so watch this space. And we've got a lot of information and updates that we share on LinkedIn, so follow us in the social media space. And lastly, if you have any questions, you can email us at sparked@csiro.au. Thanks very much, Jess and Ange.